Healthcare has had to change in the North Country because of economic factors. And healthcare has become much more centralized into the St. Lawrence Health System as the smaller hospitals' economic needs could not be met and consolidation became necessary. The needs of the patients have changed as our population has been aging, as it has across the country. So we have to accommodate to that and also make sure that our staff and our infrastructure match those needs.
The characteristics of our staff and our community, I would describe it as one big family. We are a rural, remote community. We take care of our community and our patients just like their family.
In an environment like this, especially in rural America, and this is one of the benefits of rural medicine, is that I'm not the doctor. I'm Imre, who is your neighbor. I will see you at the grocery store. I'll see you at the gas station. You take care of my kid. You teach my kid. You're my friend. You become my family. I went to school because I wanted to genuinely feel good about what I do every day. I want to deliver the best possible care that I can to a group of people who need it the most.
I am passionate about healthcare in the North Country because I know that for every person, whether it's my family or my friends or our neighbors or the students in all 4 colleges, everyone here in this region needs great healthcare.
In 2021, we were very fortunate to affiliate with Rochester Regional Health. One of the first things that we embarked on is putting our electronic medical record, EPIC, installing it into all of our hospitals. Rochester gave us the ability to have this electronic medical record that most rural health systems in the country are not able to access. And then, of course, being able to embark on this project with the Regional Care Pavilion with Rochester Regional, and has provided a significant amount of the funding to make this project viable and a reality for us up here in St. Lawrence.
Great care right here, I think, was a fabulous choice of words. This particular campaign is critical to our region because it has become very clear with healthcare the way it is nationwide that we need to have our best care right here.
The Regional Care Pavilion allows our staff to be working on and caring for patients in an environment that is state-of-the-art. This is not only the bricks and mortar that goes into a project like this, but it's the soul of the community. This is a project that will go on for generations. And what we're doing today is really laying the groundwork for healthcare in the future for the North Country.
The point of expanding the hospital is providing a healing environment for that patient and the patient's family. A completely private space so that when you are in your state of illness and when your family is there with you in your state of illness, that they have the space to privately process with you, to privately talk with your providers, to privately express their feelings, their emotions, their anxieties.
The new ER expansion is really going to advance the way that we provide emergency care in the North Country. This is basically going to double our footprint and double our number of treatment rooms, which means that we can see all of the patients that are coming to us currently and plan for more visits as time goes on. It's also an expansion in our resuscitation rooms and our trauma rooms so that we can continue to care for critically injured and critically ill patients. It's not just about the more rooms and the expanded physical space, but it's really more about the team-based approach and some of the ancillary services. And so what that's going to do is going to allow us to more quickly evaluate some of our sickest patients, specifically trauma patients and stroke patients.
We've seen several close down their maternity units in the past couple of years, with more talking about closing.
And we've taken on the task of taking care of the patients in the North Country. Our unit in the hospital is smaller. It was designed for lesser volume than what we're seeing right now. We're far away from tertiary care centers, so we're taking care of patients with low risk, patients with complications, patients with complicated pregnancies, medical problems that complicate their pregnancy, chronic hypertension, diabetes, and other conditions.
Fortunately, the advent of telemedicine also allows us to do a great deal of high-risk maternity care in that situation. We have a wonderful collaboration between our maternal fetal medicine specialists and the OBGYN doctors up in St. Lawrence to take care of women who have diabetes, hypertensive disorders, other medical conditions that make their pregnancies riskier so that they can have healthy babies and healthy moms at the end of their pregnancies too.
And in the past, patients had to travel. They had to travel to Syracuse, Rochester, Vermont to seek that care. And now we can provide that care locally. We'll have a brand new OB unit that has more beds, more rooms, more private rooms. Our new unit will have an operating room, potentially 2 operating rooms. And this will provide a lot more personalized care. Our new operating theater will allow us to do cesarean sections in our facility, and it'll expand what we can provide for the patient.
We are not unique in our shortage of nursing staff. It's a nationwide dilemma. So we're experiencing a lot of the same difficulties that hospitals across the country and around the world are experiencing with recruiting and retaining competent staff. We have a really good, committed staff. Most of them are from this area. They plan to stay in this area. They understand the patient population that we're caring for, and they're neighbors. They live in the same communities, and they want to provide good care for moms and babies to help their growing families. We want to grow our own nursing staff, and creating a pipeline is really important, and that gives them the opportunity to learn and work within the environment that we hopefully will keep them working in long term, and encourage them to go on to complete their RN degree eventually too.
We got the idea with folks from Rochester Regional of having a family medicine residency program. The idea was to attract providers to training here with the hopes that they would stay here and become part of our primary care family. And the additional advantage is that you create a culture of education which trickles down to other areas of the institution. It can be difficult to recruit new providers to a rural area. Most of the training programs are urban, and providers are used to having specialists surround them and provide that security. What we have to offer is different, but it's extraordinarily valuable in the opportunities available for the outdoors and the community spirit that you see in small towns that people find attractive once they come to live.
Why would someone get involved in a project like this? It's caring for our families, it's caring for our friends, it's caring for our neighbors. And, as my mother said long ago, if you don't have your health, you don't have anything really. And you decide that doing something, whatever it is, to help advance healthcare, not only for yourself, but for the bigger cause, the bigger picture, all of the people in the region, not just your family, but everyone, because it affects everyone. There are many people who have already joined in to support this wonderful cause that really affects every single person in our region and beyond. Whatever you can do to join us, dig deep, think about that, because this is bigger than just ourselves.